I am Dr. Daniel Potter. I am a reproductive endocrinologist with the Huntington Reproductive Center and Microsort West. I'm located in Laguna Hills, California. We do a lot of email back and forth, I would say. That's probably the best and fastest way to do it, especially if there's a large time difference where, the person is sleeping when we're up and they're up when we're sleeping. So in those cases, email works very well, and we get back to patients rapidly. Your initial contact person is going to be your nurse coordinator. So she is the point person, and and she's the one who's arranging the logistics of your treatment. I'm the one who's doing the monitoring it. I'm the one who's making the decisions, deciding how much medicine and what medicine and for how long and when everything's ready, and interpreting the data. So if you had a question, it depends on the nature of the question. If it's a question about how to mix or administer a certain medication, the nurse will usually take care of that without any difficulty. If it is a question that the nurse isn't sure about, or it's something that requires medical expertise, then the nurse will get me involved. The patients all have my email address as well, so the patients will usually, I ask them when they email me to copy their nurse coordinator, and if they do that, it will make it through my spam filter usually. If they don't do that, then sometimes, sometimes I'm not going to see the email until later. But in doing that, they're usually able to get a rapid response. And then my nurse is also checking her email probably much more frequently than I'm able to. So if something comes across the wire there that looks like it's critical or needs to be dealt with immediately, they know where to find me. So even if I'm not in the country myself, they will know where to track me down. Sí, hablo español por los pacientes que solamente hablan español. And we also have translators, and we have translators for, in the office at all times. We have Japanese, Farsi, French, couple different types of Chinese there, Russian, Arabic. We have a network of providers in most large cities, I would say around the world where the patients are coming from, that cooperate with us and help us, monitor the patients. We try to initiate the treatment cycle while the patient is still in their home country, so that we can minimize the amount of time that they have to be here in the United States. So by utilizing these local providers, we're able to, probably cut 2 weeks off of their trip. Coming from abroad, you will be working with us, and your local clinic will be serving as really a monitoring station, so they will not be involved in the actual medical decision making or cycle planning. They're going to be receiving an ultrasound order and an order for a certain type of blood test from another physician, and you're going to be presenting that to them, and they're going to be performing these tests and then giving us the results to interpret. If the services that we are providing are not legal in your home country, and this is the case with gender selection, surrogacy, in many cases egg donation as well, the clinics that we are working with, first of all, are sympathetic to our patients accessing these services outside of the country. However, there is no need for them to be involved in the case. They're merely monitoring. And so, as far as they're concerned, you're coming to the United States to have in vitro fertilization. That's it. So it's really a don't ask, don't tell type of policy. They know what's going on, but they don't really want to discuss it either, because I think that it could put them in jeopardy to some degree.